Hi listeners, Jason here. We are excited to finally announce registrations for the biggest psych health and safety community event ever. The inaugural The Psych Health and Safety Conference will be held at the Sofitel Wentworth, Sydney, June 19 to 20, 2024 and offer concurrent virtual attendance. It'll feature live podcast recordings with OG researchers including Christina Maslach and Michael Lyra of Burnout fame, Psych Health and Safety USA podcast host I. David Daniels, Australian super experts including the likes of David Burrows, a special 10-year anniversary integrated approaches to workplace mental health panel with authors Tony LaMontagne, Angela Martin and Kat Page, hand-picked case studies from organisations doing it well, and a very special interview with plaintiff Zagi Kozarov by Catherine Dunlop on that High Court case which we previously covered on the podcast. This event will sell out. Get in quick to secure tickets at early bird prices for the 2-day conference, pre-conference masterclasses, and the VIP dinner. The first 200 in-person registrations also get a copy of her latest book, The Burnout Challenge, signed by Christina Maslach herself. Find out more and register at www.psychhealthandsafetyconference.com. Now, on to this episode.
From Flourish DX, this is the Psych Health and Safety Podcast. With workplace mental health becoming a safety prerogative, this is the source of information on psychological injury prevention and health promotion.
Hi, and welcome to the Psych Health and Safety Podcast. My name is Jason Banshee, and I'm one of the hosts of the show. The aim of the podcast is to rapidly increase the knowledge and application of psychological health and safety in workplaces worldwide. To help with this, we have regular guests from around the world who are leading the way in this important area. But before I introduce our guest and topic for today, allow me to introduce my co-host, Joelle Mitchell. Hey today, Joelle.
It's been an interesting month for me.
Yeah, why's that?
So, went to the work design conference last week.
Which
was good and interesting. A couple of weeks before that, I went ice skating for the first time since I was a teenager.
Yeah.
Some extremes in terms of experiences this month.
Yeah, and I rudely asked you to miss Arnold Backer's keynote as well to do work.
Yeah.
Apologies for that.
Like the one of the best items on the agenda. But no, I have to miss it because Jason scheduled something.
Yeah, and it wasn't vindictive at all. I mean, I had approached Arnold about presenting at our inaugural conference.
I'm sure he noticed that I wasn't in the audience.
Yeah, he was like, Joelle.
In the audience of 300 odd.
Don't scorn Joelle. Yeah. I've learned that from experience. Maybe you get to see him in action in 2025 if we can convince him to come across to Sydney again for the next conference.
Well, I did talk to him and he seemed quite happy to do so. Yeah.
Yeah, good. Yeah, we'll get him on the podcast hopefully before now. JDR, job demands resources theory sits really underneath a lot of what we do. So it is a notable omission, as well as Adam Grant. So Adam Grant, if you're listening again, we're great to have you on the podcast.
Putting it out there again. Arnold was. I had a nice chat with him. He's like a very genial chap.
Yeah. No, I think him and Eva would be great to have on the podcast. Maybe get them on together. That would be pretty amazing.
Yeah. I sat next to her in one of the talks as well. So we sort of chatted about what we thought about it. And yeah, she's a very friendly person as well.
Terrific. Yeah, I did see someone actually post a podcast with her on it. Unfortunately, I think they were speaking Dutch, so I got no value out of that particular podcast. So despite my surname, I do not know how to speak or interpret Dutch.
Good to know, I guess.
Yeah. Don't speak to me in Dutch, Joelle. I will not understand.
Or maybe I should speak about you in Dutch.
Yeah. There's nothing you wouldn't say to my face anyway, Joelle.
You can't be certain of that, Jason. Just imagine.
Wow. Yeah.
Joelle speaking Dutch. What have I done?
Well, anyway, our guest who is in the studio with us today has actually been waiting very patiently. So we should probably bring him in.
Yeah.
Okay.
Well, he's already here.
Yeah. Well, okay. We'll bring him in. So
we'll invite him to join our conversation.
Yeah. It seems really rude that we're having this conversation.
Just literally over the top of him.
Be quiet. Yeah. Okay. All right, we'll bring him in. So he is a clinical psychologist, won't hold that against him, with published peer-reviewed research on topics including integrated healthcare, psychotherapy outcomes, and the intersection of social identities and mental health. With previous experience with the US Department of Veteran Affairs, he currently leads a team of experts who consult with employers on their management practices, corporate policies, and learning and development programs. He is the Senior Director of Workforce Transformation at Lyra Health. Very warm welcome to the podcast, Dr. Joe Grasso.
Thank you for having me. I'm very eager to contribute to a podcast that is often on my playlist, and you have a lot of fans on my team in the United States. So I'm creating a nice fan moment for them too by appearing on one of their favorite podcasts.
Yeah, terrific. No, it's a pleasure to have you, and you are one of very few people, a very select number of people who are actually recording from our studio rather than remotely over Teams.
I'm just glad for the opportunity because it means I have gotten to visit Australia, which is a first for me. So a privilege in many ways.
Yeah, glad to rescue you out of the cold North American winter and bring you to some summer, and we're going to get to Rottnest, I believe, tomorrow. Get your quokka selfie, get some sun, some beach.
Yes, I'm ready to make everyone jealous with my quokka selfie. That's going to get attention far and wide, and I will be sharing it on all of the internal channels at work.
Yep, yeah, you, Roger Federer, Chris Hemsworth, Joe Grasso.
Everyone's doing it.
Typically the company I'm lumped in with. So.
Yeah, it's a blessing and a curse. Yeah, nice. No, great to have you, and looking forward to the conversation today.
Likewise.
So, what podcast do you like to listen to, Joe?
Let's see. So, the Happiness Lab, Laurie Santos, a big fan of that one because it's all about how do you take behavioral science research findings and apply them to your own life to enhance your work life, your personal life habits. The psychologist in me loves to nerd out on that. And then as a clinical psychologist, I have a soft spot for podcasts that are about relationships. And Esther Perel, a relationship expert more typically in the couples therapy, romantic relationship realm, has a podcast called How's Work? And it's all about the interpersonal dynamics and factors that drive relationships in the workplace. So how apropos that I'm talking to a couple of folks who have a famous interpersonal dynamic of their own in the workplace.
Yeah, we haven't defined whether it's healthy or not.
It's interesting.
Interesting. Good description.
Fun for listeners, at least.
Certainly entertaining on the outside. Yeah. Joe, can you tell us about your professional career?
Sure. So as was mentioned, I'm a clinical psychologist by training. Very proud of that. And
yeah, you do you, mate. Yeah.
Yes, not all of us can be organizational psychologists. So I had a focus in my grad school career on research about men's mental health, interventions at the individual level, support improved mental health outcomes, but over time I started to get more interested in the macro. And when I completed my program and I did my postdoctoral fellowship, I shifted gears toward research on systems of healthcare and how do you develop models of mental health care that improve access to that care. And one of the models of care that I was first interested in was primary care health integration. So literally integrating mental health providers into a general practitioner type of clinic, which is often the first place that someone will go to when they're experiencing a mental health need. And the research work I did on that care model and my practice work in it parlayed into a job with the US Department of Veterans Affairs, where they essentially scaled that model across a national healthcare system for veterans. And that was a wonderful opportunity to do some really applied research in that area, to lead an implementation effort around a new model of care, and to learn how to promote fidelity to a care model. And I took all of that learning and shifted gears and applied it to a very kind of care model when I joined Lyra in 2018. Lyra is a workforce mental health company that provides benefits to employers that enables access to their workforces to a whole host of mental health services, therapy, coaching, medication management. And when I joined Lyra, I joined as a manager of clinical quality. So my focus was on the provider side of the house. How do I ensure that Lyra is maintaining its quality standards across a large network of providers, making sure that they're practicing evidence-based treatments, making sure we're curating the network when treatment outcomes aren't what we expect or there's a complaint or concern. And this is where my career takes an interesting turn because it's a pretty linear story in a way up until this point. At Lyra, when I joined, we're still a earlier stage company, so everyone had side work. Even my boss was, she used to tell me how she was assembling furniture at our office. Everyone had their side projects.
Yeah, we've done that. Joelle does podcast hosting as a side project.
Yeah. Oddly familiar as a concept, yes. So I didn't have a podcast, but I did do workshops for our employer customers on various mental health topics like stress, resilience, sleep, mental health awareness. And I loved it. Even though it was my side gig, I really drawn to it, and it started to grow as a responsibility for me. Fast forward to 2020 and the outset of the COVID-19 pandemic, the demand for those kinds of trainings, these kind of approaches to addressing mental health literacy was at an all-time high. And I was really at a crossroads where I had to decide, do I stay on my career route to date, which is focused on care models and care delivery and evaluation of providers and care outcomes, or do I switch gears to this employer-focused work where I'm in more of a consultative role to employers? I'm developing trainings and delivering education in the workplace. And I decided to take a chance and move in that direction and devote my role completely to that work. And since 2020, it's grown very organically in response to what our employer customers have needed. So now I have a team of 15 folks that includes instructional designers and subject matter experts, all focused on developing learning content around workplace mental health, supporting employers around their internal initiatives, whether that's DEI and B, whether that's peer support programs, whether that's preventing workplace risk of mental health harm. And the great news is, Lyra is really invested in this organizational work. So it allows us to continually look at what's next, what's the next best way to support employers in creating a mentally healthy workplace. And we're continuing to evolve those programs.
Yeah, I think a nice example there of where job crafting, which is essentially what you're doing, can actually have a really significant benefit, not only to the individual and how they feel about their work and themselves, but actually to the business, where your job crafting actually opened up a whole new kind of line of client service, really.
Yeah, a lot of credit to my boss at the time, Elaine, if you're listening, credit to you. She really had a vision for the value of embedding a clinical subject matter expert onto what was a go-to-market team, really advising not just our customers, but also marketing and sales and customer success, these go-to-market functions that really benefited from having some, access to easy expertise around mental health, given their work was so often having to represent mental health concepts to employers. So she saw that opportunity and let me run with it, and I'll always be grateful to her for that.
Mm.
So, Joe, Lyra isn't really a brand that is well known in Australia, but it is a behemoth of a mental health startup in the US and now more broadly globally. To give you an indication, some of the largest EAPs in Australia maybe service up to 500,000 lives. So it'd be really interesting to hear and maybe to share with our listeners, the sort of scale that you guys are working at Lyra.
Sure. So Lyra is, we were founded in 2015 in the US, and we, have grown exponentially over time so that now we serve, I think, 2,500 plus employer customers and over 17 million lives covered around the globe.
Yeah.
So it is a massive scale. And I think a real testament to the effectiveness of our approach and the fact that we were entering a market that was really ripe for disruption because the status quo was posing so many problems to employers and users of the service alike.
Yeah. So tell us a bit about that, right? So EAP, it's been around for forever, right? What tell us a bit about the founder and how we got to this point where he decided it was a good idea to do EAP and maybe bring a different spin to it.
Yeah, I love that question because to me, it's such a beautiful story. Our founder, David Ebersman, is the former CFO at Facebook, and he was seeking care for his son. He was looking for a mental health provider and finding that he was facing a lot of the challenges that many of us, especially in the United States, face with finding access to high quality care. You're often going through your health insurance plan. That means you're getting a list of providers without any ability to differentiate between them. You don't know which ones are going to be specialized in the issues that you most need support around. You're playing a game of phone tag. You don't know if these providers are actually taking the coverage anymore. A lot of providers who are in network are actually not taking that coverage anymore. You're getting a lot of no response, and you're getting a lot of variable quality. And so his pretty um, you know, discouraging experience with accessing mental health care, especially for your son, which is a whole nother level of concern, inspired him to take action in this area. And one of the earliest innovations at Lyra was the development of our machine learning approach to matching people to care. So when you come to Lyra, rather than getting a list of providers and saying, have at it, we actually ask you about the problems that you're dealing with and your preferences for care and your needs. And we then match you to a subset of providers who are specialized to address your unique needs and preferences. And we've vetted all of the providers in our network for the practice of evidence-based treatments. It's kind of appalling to me that in mental health, there's a very different standard when it comes to evidence-based practice. You would never go to an orthopedic surgeon and accept that surgeon telling you, hey, I'm going to try a little bit of this, a little bit of that, and we're going to see what works. And, I practice in an eclectic way. It would never fly. Hopefully no one would accept that as their care. In mental health, that's too often the case. We know that there are over 500 different types of psychotherapy. Only 20% have sufficient evidence base to be considered effective. And so at Lyra, another early innovation was curate or building a provider network from the ground up that was specifically based on vetting providers for their practice of evidence-based treatments and then compelling them to measure outcomes using clinically validated measures, not measures we created, but measures that are the gold standard in healthcare to make sure that we're not just getting people into care, but they're actually getting better because of our care and that those are durable outcomes. We will even measure outcomes 6 months post-treatment as an example. And we're able to show that those the symptom improvement, the clinical recovery is still in effect beyond the end of the care episode.
Yeah, I mean, it's a huge problem, like you say. Many providers just don't measure the effectiveness, let alone that 6 months post measurement as well to make sure that the treatments are effective. Often, EAP is seen as a band-aid solution. Hey, let's just get them back to work. That's like the only thing we're really worried about. It's not like, do they actually recover and stay recovered over time?
Right, and it's we've found this sweet spot of the perfect win-win situation for employer-employee. The employee is getting access to care that's much easier, more seamless. They're getting care that's effective, makes their quality of life better. great for the employer as well, because rather than spending on mental health support, for months into years, which is often the case for people who get ineffective psychotherapy, you're paying for one really effective episode of care. And you're also demonstrating good ROI, so that if your CFO is asking, well, what is what's the output of this program that we're spending money on? It's a very clear and compelling story to tell of getting people better faster.
Yeah, no, absolutely. And we'll talk more about that. But I know individual level interventions in workplace mental health have got a bit of a hiding lately, and a lot of it is because of ineffective measurement. But that's obviously something that Lyra does in spades, and yeah, we'll unpack that a little bit more in today's podcast. But I guess what's of real interest to me, right, is where you're now thinking, which is around the systemic and thinking about psych health and safety. And I've got to say, when we started talking 2 to 3 years ago, it really baffled me because we talk regularly around how the US is probably 10 years behind where Australia is and other parts of the world in their thinking around both health and safety more generally, and then psych health and safety more specifically. I mean, I feel bad for David Daniels, who is who as well, who is running our Psych Health and Safety USA podcast. He's up against it. He's doing a lot of education over there. So it really surprised me, given that we've heard from a lot of people internationally that Australia are really seen as leaders in psych health and safety. That some of our EAPs locally have only really started to think about psychosocial risk management, psych health and safety in the last maybe 6 to 12 months. But here you were over in the US in this what we would class as an immature market for psych health and safety, and you're already thinking about this. So, what kind of got that to your attention, and why in the US would you be focusing on this?
Yeah, it's a great question, because you're absolutely right. We're very early to this concept, even to the extent that it's known as a concept of psych health and safety. My interest in this area was also very organic. It's a testament to the fact that at Lyra, everything that we build is with the employer, customer, and the member at the center. And when I reached out, it was 2021. We were emerging from the pandemic. Employers were calling folks back to the office and finding a surge in burnout. And we, in turn, were getting a surge in requests for training around burnout. And that's what a benefits leader, an HR person knows as a go-to solution. And on my team, just like at every other team at Lyra, we look to the evidence. We want to make sure that whatever we're developing to address the problem has the right research base, and the content that we're building is aligned there. And so when we look at the research base on what is effective for addressing burnout, everything, understandably, pointed us to systemic solutions, and recognizing a individual by individual approach to treating burnout is inefficient. It's largely ineffective because it doesn't address the root causes, which are systemic workplace factors. And to me, this was really good news, because it meant, employers actually have much more control over this particular mental health problem than most of the ones that they're trying to support employees with by offering Lyra. And so the question for me is, how do I support the employer in taking on the work to address this area of more direct responsibility when it comes to workplace mental health? And it became very clear that psychosocial risk management is the approach that employers can take to do this in a systematic way. And in 2021, there weren't many folks doing psychosocial risk management as a vendor providing a solution in this area. And so I was eager to learn as much as I could. So when I found one of your LinkedIn posts, Jason, I remembered saying that, like, what that guy is doing is exactly what we should be providing. And I reached out, and I think I just expected to have a chat. I think you expected to just do a demo. But I think by the end of the call, we both recognized how we were really speaking the same language, even if we weren't using the same words. And we both had this kind of shared commitment to this type of work and a belief in its importance.
Yeah. Yeah, I remember the call and going, "What's this EAP provider in the US? Like, why are they interested in psych health and safety?" It just did not seem to be a good fit. But clearly, we clicked, and 3 years later, here we are.
Yeah.
Um, so tell us then, because again, we know the US market is struggling with this concept. There's a big focus, like you say, in benefits in the US rather than changing the systems, which is our focus.
Mhm.
You don't have the same health and safety legislation as strong as what we have around psychosocial risk in Australia. So what do you find when you're talking to clients now about this topic is resonating? Like, how do you frame it in a way that they can understand, given that they don't have the same kind of lexicon?
Yeah, I think the entry point for us is usually burnout.
Mm.
Employers recognize that burnout is rampant. It's intuitive to them that burnout costs the business. There's reputational risk, there's risk to productivity, there's risk to retention, and of course, there's very real risk to people's mental health. And at Lyra, we're very fortunate to work with customers that are savvy about the importance of addressing mental health, but they're also committed to this because it's the right thing to do. And there's interest in having a more comprehensive approach to addressing mental health. I think employers just may not, especially ones in the US, may not know what it looks like to address the primary prevention piece of mental health. Interestingly, where there's been a lot of traction around the prevention piece in the past couple of years with employers in the US has been around social determinants of health and wanting to see mental health solutions take on more of an expanded portfolio of services for addressing things that affect people's mental health, like job or food insecurity or housing insecurity or um, either even social connection and loneliness. And so employers are kind of taking this more expansive view. But what's so interesting to me is work is a social determinant of health,
Mm.
but it's often just overlooked. And I think it's because the the person that we're typically working with on the employer side, their portfolio is typically focused on personal well-being.
Mm.
And even though social determinants of health are often about personal factors, work is one of those factors that is actually directly affecting well-being, but again, more in the direct responsibility of the employer. And so when we can point that out to an employer in the US, and we're not necessarily using the phrase psychosocial risk management, but we are highlighting, hey, here's an opportunity for you to address this burnout issue that you really care about, to address the social determinants of health in a more direct way by intervening on work, that can really make some light bulbs go off.
Yeah, I mean, it's making some light bulbs go off for me as well around what sort of language to use in the US. Um, yeah, like you say, this term psychosocial is not new to people.
Mhm.
Psychosocial risk management might be, particularly in a work context, is a bit different. But yeah, framing it as the social determinants of mental health, but particularly going, well, work, like you say, is a social determinant.
Mhm.
Like, and like you say, it's something that employers can control a lot more than say food insecurity or housing insecurity. Yeah,
Exactly.
Although one could argue that food and housing insecurity are somewhat linked to employment.
somewhat.
Yes.
Yes.
Not
Yes.
completely, but
No.
there's a relationship.
Oh yeah,
Yeah.
absolutely. Yeah.
Yeah.
Yeah. You need a living wage. Yeah.
Yes.
Right.
I think, what, just to reflect on what you've said, Joe, and in our experience, we find that when we're able to frame the work that we're doing using a mental model that's already familiar to the audience, it's a lot easier to um, get them past the I don't understand,
Mhm.
rather than trying to teach a whole new concept and framework. So, when we're talking to safety people, we frame it in safety language and models. And yeah, if you're finding that the US market understands the idea of social determinants of health, then I think it's a very easy model to apply to psychosocial risk management.
I agree, and I think it's pairing the understanding of social determinants of mental health with also an understanding of primary prevention. So if we're working with someone in benefits, let's say that's my primary point of contact at a customer company, they'll understand the value of primary prevention. They're in charge of purchasing health insurance potentially for the workforce, and they tend to have an appreciation for public health, and so that's another in that I have. Like, let's think about how to provide mental health support for your population. So this is taking a population-based health approach. It's taking a primary prevention approach, and we're trying to prevent people from needing care because of work. So that frame of reference is also, I think, familiar to our customers.
Yeah, definitely.
But taking this kind of approach is very unfamiliar. So even though the framing might resonate, there is a fair amount of education that, as you'd expect, we have to do to help them to understand what it looks like to take this responsibility.
Do you need more psych health and safety in your life? Then head over to the FlourishDX Academy for several free on-demand e-learning courses. If you're an internal professional, follow FlourishDX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the FlourishDX Academy. www.45003.org. Now back to this episode.
Yeah, definitely. Quite a lot of fear management as well, we find. Yeah.
That's a good way to put it. Yeah.
So interested in your observations about, I guess, the EAP landscape in particular in the US.
Yeah. It's very fragmented. I think employers use, as you were mentioning earlier, use EAP for different reasons. In the US, you have very small regional EAPs that are serving legacy customers that have just been there for years. Sometimes EAP exists because a customer, commissioned this service and it just happened to grow. So you have those small players. Then you have these large behemoth EAPs that have been operating for a long time. They've probably been through multiple rounds of acquisitions and mergers, and those are the ones that we are typically replacing because the experience with those EAPs tends to be frustrating for a lot of employers, especially large employers that are wanting to address care access. Even if those large EAPs are tinkering around the edges and making improvements to how they get people into care, ultimately they still have the provider network that they maybe built. Maybe they're renting from another provider that wasn't built from the ground up with an eye toward quality. So those providers are just not going to have the same quality standard qualifications that would be in our network. Then there are companies that are using the EAP purely for compliance reasons, and the value of EAP to them is much more around having checking a box around regulatory needs, or providing a service for mandated referrals if they're in a safety regulated industry. So what we're finding is our service can really meet all of those needs, but we've grown organically over time to expand the portfolio of services that we have to ensure that whatever the need is for the EAP, the services are under our umbrella. And that's where I've been really fortunate on the organizational side to grow the organizational suite, because there are customers where the primary value for the buyer is not just access to care, but it's support to them and their HR team. What do we do when there's a crisis in the world or in the workplace? Or what do we do about the fact that we have employees who have trauma exposure as an inherent occupational hazard on the job? And that's where we've been able to come in with specialized training and consultative support, and then more recently psychosocial risk management work to kind of address the full scope.
Yeah, and so do you employ therapists directly?
Yeah, so we have a network of providers that we do employ directly. Those providers are delivering what we call Lyra Care. This is a unique model of care that Lyra developed based on evidence-based therapies, but recognizing there's a whole week of life that's happening in between weekly therapy sessions, and that's where the real work needs to happen to implement the skills that you learned in therapy. So in Lyra Care, the network of providers that we employ are assigning learning content, homework, exercises that are designed to get the client to practice their skills. And then we're measuring the outcomes of that care across the entire care episode. And we've published in a peer-reviewed journal findings that showed the outcomes of that particular model of care exceed rates of clinical improvement and recovery, and even some randomized control trials, because it's just such a wraparound model and very applied model of care. In addition to those providers, we also have a larger network of providers that we contract with, but we direct contract with them. And that means we're able to have better quality assurance. So we know the therapies that they practice, we can compel them to measure the outcomes of their care, and then we can curate the network based on the outcomes and any feedback we get about those providers. And that's in real contrast to a lot of traditional EAPs and even some newer ones that will rent their network from another vendor, and they really have no quality assurance capabilities because they have such an indirect relationship with those providers.
Mm. Can you talk a bit more about the quality assurance and I guess for members of our listenership who maybe aren't familiar, what does that look like and why is that so important?
Yeah. So, I would say to anyone who's evaluating EAP, whether you're on the consulting side or the employer side, or you're maybe a partner vendor, it's really important that the EAP is evaluating quality in terms of clinical outcomes. And that doesn't just mean satisfaction with care. It doesn't mean that you used a measure that you created as the EAP and the data look good. It means using clinically validated measures that are the recognized gold standard. So, for us, we use the PHQ-9, which is the gold standard measure for depression, the GAD-7 for generalized anxiety, and and we're also measuring things like presenteeism, absenteeism, productivity, so that we can show that people aren't just making improvements on a scale, but that they're actually improving on validated measures. And it's not just improvement, it's actual clinically significant improvement, because on these measures, you can essentially create benchmarks so that you know whether someone is moving from severe to mild. And that really is the benchmark for determining if someone truly got better. If you say, oh, someone went from a score of 12 to a score of 10, well, what does that mean? Is that significant? For us, it's making sure that the change in outcomes is clinically significant. And ideally that we're driving people to clinical recovery. We've been able to show that in our data.
Yeah. Okay. And so that's the type of thing that I like as a client who was looking at EAP, different providers, they should really be thinking about how are they measuring quality outcomes.
Exactly. And from the very beginning, thinking about how you admit people into your network. So you want to make sure that the EAP you're talking with is evaluating their providers, not just do you have a license, but do you have basic qualifications, but do you practice evidence-based treatments? Do you provide care in a way that's culturally competent? That's another thing that's important to us at Lyra. We have part of our vetting process dedicated to making sure providers are providing what we call culturally responsive care. And then we also invest in the providers with continuing education on an ongoing basis. And for those providers that we direct employ, those Lyra Care therapists, we provided last year over 100,000 hours of clinical supervision time. So it really becomes important to see that the EAP is investing in the practice of providers in the network and their continuing education, so that you're not just high quality when you admit them into the network, but you're helping support their continued high quality of practice.
Mm. Yeah. So I guess being an informed buyer is very important in actually being able to, I guess, understand the difference in service offering outside of cost.
Right. And uh, there's so many aspects of our work at Lyra where there's a market education piece, whether that's psychosocial risk management or evaluating clinical quality. But the reason to educate the market in this way is because we're looking out for folks. You don't, as a employer, you don't want to invest your limited funds in a program that has poor ROI. It's not meeting the intended objectives. So the more that we can make clear what the criteria should be for evaluating solutions, we think their the end result is employers are much more savvy about selecting a solution that's actually going to deliver the results that they're aiming to achieve.
Mm.
Yeah, it's interesting in Australia. We do see often it's a race to the bottom, like who can provide the cheapest service rather than the best service. And it may be because we do have a national healthcare system, right? Not to rub it in.
Oh yeah, we can. I'm not going to defend that. Yeah.
I don't think we should waive our national
Privilege.
health. No, I mean, from a mental health perspective, our public health system isn't great.
Yeah, so EAP. So I know you mentioned that, Joe, before. You saw you didn't see maybe as much value in EAP as maybe in the US. You don't have the national healthcare system, but there's still such a waiting period for mental health services in Australia, even though we do have a national health service, that if an EAP service can bridge that gap and give people quicker or more rapid access to care, then that still is a value. But what you're talking around measurement, I can see how that would resonate more strongly in the US, where you don't have the national healthcare system to fall back onto, and generally it's the employer that is providing the medical benefit, right? As part of a benefits package, they're paying for that, so they're more incentivized to offer a better quality of care, so people don't need as much care. Yeah,
exactly. And the cost for a care episode, you have to think about it in broad terms. If that person doesn't need to come back to care, that's huge value savings for the employer, and that's what you show. That's where we have really well aligned incentives with the employer. We want to get people better faster, but we also want to get them better in a way that's durable, so that not only is that person not needing to come back to care and they're able to live their lives without their mental ill health being a hindrance, but the employer isn't having to pay for more care later because the clinical recovery endures over time.
Yeah. So, given how rigorous your measurement is within your platform, have you been able to demonstrate then some sort of ROI in terms of or in comparison to traditional care models?
Yeah, we've been able to show that over time we're cost efficient, and what will happen is an employer, especially in the U.S., where you have the healthcare spend through the health insurance plan, we offset that so that the outpatient mental health care spend decreases the longer that Lyra is in effect, because you're getting more people through care with us, and those people aren't coming back for more care, and you're also treating them effectively so that those conditions don't actually worsen and lead to more costly care, like inpatient or emergency room care. And then you have all of the research around the ways in which mental health conditions intersect with physical health conditions. And someone in a state of mental ill health is going to have difficulty with good health behaviors, medication adherence or treatment adherence for their physical health issues. So, there can also be a ripple effect from people getting effective mental health treatment. They may also be reducing the costs of physical health care claims over time as well.
Yeah. And I think what you're doing is so important and so valuable. And I don't think a lot of people maybe recognize that just off the brochure, if you like. But, we've talked this week about, Will Fleming's research. And Will, if you're listening again, we'd love you to come on and talk about your research looking at individual level interventions and largely their ineffectiveness at a population mental health kind of level. But, at Flourish, we really subscribe to the integrated model of workplace mental health, right? Where it's not just about preventing harm, which is, our largest focus in thinking about things systemically in workplaces, but also what are we doing to promote wellbeing, but also what are we doing to support those with ill health. So there's always going to be a need to do that, but whatever the intervention, like how are you measuring it is important. It's even things like, even thinking about positive work design, thinking about how do we make work good for people. We can take the evidence base for what works and just apply it in any context and go, we did it, right? But unless you're actually going back and checking your work and going, does this work for this population of workers that we've got? And then iteratively improving with feedback, unless you're measuring it, you can't do that, right? You're just sort of crossing your fingers and hoping for the best. So it's really great to hear that, measurement is a core value proposition, I guess, within Lyra, so that, you are making sure that people get quality care and you can continually to adapt to people's needs.
Absolutely. And I think that's why folks at Lyra got it when I pitched this idea of psychosocial risk management internally. It's measurement, and everyone at Lyra understands the value of measurement and taking a more systematic approach to helping employers consider ways of working. But first, you have to be able to measure what is the status quo. Like what are the ways in which work is affecting employee mental health, and what does that impact look like, and how does it look different on certain teams or in certain profiles of workers? And so, even in just diagnosing the problem, you need measurement. Let alone once you've actually taken action, and that's something that I think really resonates with our customers when they do get this concept, this idea of we need to know that what we tried worked. And so first, let's understand what the problem is. Then let's understand how to target the right intervention, because so much of the time and effort that employers spend trying to address issues like this, but without good baseline data or good understanding of the factors that are driving workplace distress, it ends up being like, let's throw things at the wall and see what sticks kind of approach. The idea that you can take a much more targeted approach because you're doing it in a data-driven way, I think makes a lot of sense.
We've strayed quite significantly from our list of questions, which is
such
fine.
an interesting guy.
I'm a rambler, so thanks for following me. Take us on a journey.
Yeah, I was just while you were talking, I was sort of getting annoyed at the fact that employers in Australia can just do tremendous harm to the mental health of their workforce and then foist it off onto the
EAP.
The public.
Oh, the public health system,
to the taxpayer to fix. Yeah.
Yeah, that's such an interesting observation. I mean, it immediately makes sense when you say it, but how many people are putting two and two together that way?
Well, probably not. And it goes into you need to see your GP to get a medical certificate if you're sick from work, and the taxpayer pays for that as well. So, we're making the taxpayer pay for a bunch of our governance and fixing our messes.
Yeah.
Yeah, there's Joelle's mini rant for the day.
It's not often that I hear in the US, I think we look to other countries as these oases of public health systems, and they know, they've figured it all out. So it's validating to know that even a mature country like Australia with a national healthcare system hasn't figured it all out.
We look to Scandinavia.
Yeah, we all look to Scandinavia.
They've worked it out. They've worked out education. They worked out homelessness. Yes.
Yeah, they've just got it all. Let's all move.
Yeah, if only it was warmer.
I was going to say, then I miss this beautiful Perth weather.
So we've talked a little bit about what employees should look for when contracting an EAP, and that measurement, right, being able to show an evidence base for providing effective care, right, not just providing care.
Yeah.
Right. And what are some of the other things that employers should be looking for when evaluating EAPs?
Yeah, for us, it's really important in us positioning ourselves as a workforce mental health solution to address the full spectrum of mental health need. So that means having support for the full continuum of need. So everything from true primary prevention, which is everything that we're doing around psychosocial risk management and organizational development in mental health, all the way through to treating more severe and complex conditions. So at Lyra, we have specialty care programs for things like suicidality, substance use disorder. So, and then of course everything in between. Your depression, anxiety, trauma disorders across the mild to severe range. So, when you're evaluating an EAP, you want to be thinking about quality, you want to be thinking about access, but you want to be thinking about comprehensiveness and making sure that you're considering the needs of everyone in your workforce and you're not leaving anyone out in the design of your benefits configuration.
Yeah, and we are seeing more EAPs actually reach out to us, funnily enough, in Australia. You, like Lyra, was a lot earlier. The funny Australian ones are going, well,
funny enough.
Actually, it's more than just doing a survey, funnily enough, psychosocial risk management. And like EAP, there needs to be some quality assurance and the right kind of people, right, using the right evidence base for what they're doing as well. So it seems like many local EAPs are following the Lyra lead and going, we probably do need to provide that broader range of services that do go further upstream to prevent, I guess, the need so much for stuff that was within the employer's remit to be able to resolve.
Exactly, and I think in the U.S., it's organizational psychologists are they're harder to find. They're not. It's not as kind of robustly represented discipline, and for us, we've been intentional about hiring folks with an organizational development background. So even if they're not organizational psychologists, they're oriented toward thinking about systemic solutions. They're oriented toward thinking about making interventions in the workplace work for people's ways of working and what it looks like to implement complex interventions where you're impacting multiple teams or multiple departments. And I'm really proud of that because it would be very easy for Lyra to stay in its lane of clinical hiring and focus only on hiring clinical background folks. But you need to be able to complement the work of clinical folks with those who have a more organizational and systemic background and applying that in the workplace.
Yeah, and I mean that's sort of our approach as well, right? We've got a mix of clinical and org psychs on the team, and we do, I think, get a lot of value out of those team members who do have that experience working at the individual level, and especially, as Jason was saying, we do support across that the range of the integrated model. So where we do have clients who want some support in things like their return to work programs and those types of things, that's where we see really significant value in having those team members with that clinical experience, or even org psychs who have been doing sort of work-based counselling and coaching at an individual level.
Yeah, such a good pairing.
Yeah, and we are starting to see more organisations go, well, actually, you know what? We're not getting great data from our EAP. We need to evaluate all of the different mental health interventions that we are already providing as a service to our employees. So that's actually a more common scope of work that we're being asked to do for our clients as well. Can you come and evaluate our EAP or our peer support program and go, well, is this actually effective or not? Because what you'll often find, I know we had a joke before about this, Joe, about when you look at an organization's risk register and you're like, I've never seen a risk register in a US company before. But organizations commonly now in Australia are having psychosocial risk as a row in their risk register. And then when you look at the controls that they've got, there are things like the EAP, the peer support program, education. We do Are You OK Day, which is a cupcake day. But those are the things, but no one's actually ever stopped to evaluate, are these things effective or not, if we're calling them a control. Yeah. So to that point, what would you encourage employees to look for, or what's the key criteria in evaluating EAP performance from your perspective?
Yeah, I mean, I think it's the clinical improvement and recovery data. I think it's evaluating the comprehensiveness of the solution. I think it's another common area of kind of trickery. Trickery is a strong word. Maybe
Conniving.
yeah, I want on a record. I'm not accusing anyone of being conniving, but a source of confusion, I'll say, is around how to evaluate access to care based on number of providers. At Lyra, we evaluate access to care based on capacity. How much capacity do our providers have in a particular area to provide easy access to an appointment for anyone who's searching for care? And we do that not just for our generalists, but also for specialty conditions. What a typical EAP will do is they'll say, well, we have X number of providers, so you can be assured of access. That says nothing for whether those providers are going to take your clients, whether they have any capacity to take your clients, or whether they even want to take the coverage that the EAP is providing, because the reimbursement rates for a traditional EAP are often abysmal. So,
not to mention the special care needs.
Not to mention the special, exactly right. You may be ways in which an EAP network might build up its provider network are often with not a lot of regard for specialty care needs and curating providers who can treat conditions that are less common. But at Lyra, we're proud of the fact that if you're in rural California and you are dealing with trichotillomania or hair pulling, we'll have a specialist who can treat that condition, and that's often not a consideration in the same way for an EAP.
Yeah. And we spoke a bit about that's one of the reasons why Donna Lawrence at St John Ambulance here in Western Australia, went towards an internal EAP model where she was able to identify those special need providers, right, that could take care of things like PTSD, trauma exposure, that sort of thing that isn't generally as high a need for, say, a retail audience, for example.
Yeah. And that's when you're talking about the EAP landscape, that's another piece of it is the internal EAP. And, we have actually partnered with several different employers who still maintain an internal EAP because they have the organizational component of the EAP down. Like they have professionals that are hired and have been working in those roles for a long time who really know the internal workings of the company and the company culture, but they see the need to supplement that with access to a much bigger network of providers. So we actually work with a lot of employers that have an internal EAP, and it's a nice complementary relationship with what we do.
I don't have any more questions. I think
I've talked you both out. I feel like that's some kind of record.
Yeah, look, I'm not going to throw shade on any of the other several people that we've had, and we've spoken a bit about EAP. That was a really enlightening discussion, particularly with that US context that you've been able to put on it. So,
I appreciate it. I always appreciate when people have interest in this topic, and kudos to both of you for seeing the ways in which our work is really complementary and all part of that integrated model of workplace mental health support, because that's how we think of it at Lyra too.
So I guess the question, and you know this question, Joe, because you've listened to this podcast a few times yourself, but the question that I like to ask all, I guess, at this point is, what are your hopes for the future of workplace mental health?
Yeah, I was thinking about this, and something you said earlier actually made me change my answer. My hope for the future of workplace mental health is that measurement is the necessary component to everything that we do. That becomes the standard, and that employers compel any point solution or vendor that they're working with on workplace mental health, whether that's for training, whether that's for risk management, or whether that's the EAP, to have outcomes and to provide the kind of measurement that gives reassurance of ROI and impact. That's my hope for the future.
Yeah, I mean,
spoken like a true IO psychologist.
Yeah.
I think it's buried in me, the IO psych.
That's in this side, right? We're supposed to be a social science, right?
Yeah.
So we should be applying scientific principles.
That little thing called evidence-based practice.
Yeah,
that's right.
Yeah. And evidence-based practice is not just taking something that's evidence-based and applying it in a context, and like I say, crossing your fingers and hoping it works. It's measuring it and making sure it continues to work.
Mm-hmm.
Yeah.
Yep.
Exactly.
The scientist practitioner.
Mm-hmm.
All right, Joe, last question for you today. Words of advice for listeners who are interested in working in the field of psych health and safety.
Well, I'm going to have my unique American perspective on this. I would say if you want to work in the field of psych health and safety, be prepared to be an educator, because there are a lot of people who just still do not know this concept. They're not familiar with it. And their lack of familiarity with it is an opportunity to help them understand the value. And so sometimes I can find myself getting a little impatient, like, why don't you understand the value of this? It's just such a paradigm shift for employers' way of thinking about their responsibilities and the opportunities that they have to support worker mental health. And so, I would say, lean into your role as educator, get curious when there's confusion, get curious when there's misunderstanding, and be willing to take the perspective of the person you're trying to educate and recalibrate your message in a way that gets it to make sense for them and uses their language.
Nice.
And Joe, we have seen you do lots of education through different mediums. When is Joe the podcast going to start? Because I reckon you've got a beautiful voice and a great, you're very articulate. I think you'd be amazing as a podcast host.
I can't remember the last time I received such a thoughtful compliment. You will have to ask my team. Maybe this is hint to my team. When I get back to the States, we can start talking about our own version of a podcast. And you gave us a nice template. You haven't convinced me I would need a co-host. I need to bounce the banter off someone.
Yeah, I reckon you and Karen could get there.
Yeah, Karen, if you're listening, let's talk about how we can make that happen.
Yeah, we're also running a petition to try and get Karen across to Sydney for our conference in June. So if you want to get Karen there, email Joe.
I was going to say Dan.
No, Joe. Yeah. Get email Joe to get Karen across to the PHS Con. Hey, Joe, it's been a real pleasure having you on the podcast. It's been awesome hosting you over the past week. Looking forward to our Rottnest trip tomorrow. But thanks so much for coming on and sharing your thoughts.
Thank you both. I just want to end by saying I have so much genuine admiration and appreciation for the work that you're doing, and I'm so glad to learn from both of you.
Oh, mate, we're just complimenting the hell out of each other.
This is a love fest.
You go and throw up in the corner.
Yeah. Okay, now we're back.
All right, thanks, Joelle. All right, well, listeners, that brings us to the end of this episode. Remember, we do record these things over video, so if you want to see our awesome studio with Joe in it for one of the very few times we've had a guest, you will be able to catch that on YouTube. We also will be taking snippets from this, like we always do from all our podcasts, and putting it on the Flourish TX LinkedIn page. While you're over on LinkedIn, if you want to continue the conversation, all three of us are on LinkedIn quite regularly, and we're all friendly. So do reach out if you want to chat. But that's it. We'll catch you next episode.
You've been listening to the Psych Health and Safety Podcast. To stay up to date with the latest on psychological injury prevention, follow Flourish DX on LinkedIn and subscribe to the Psych Health and Safety Podcast at www.psychealthandsafety.com.